This video describes steps for surgical preparation prior to an exploratory laparotomy. You can see here the black line denotes the incision that would be made. The purple shows a circle of the more clean area, and the yellow is between the yellow and purple are the less clean area, and that area includes the sheath denoted by the star. Initially, the horse would be induced and laid on his back. Many horses will have had an initial clip, and the surgical prep would include a cleanup clip. So just clipping any missed hairs and making sure the area immediately around the incision is clipped nice and short. Then the vacuum's used to remove any free hair and crusts of dirt. You can see she's applying the apron and exam gloves, not sterile gloves. So this is the ivory prep part of the dirty prep. This should last 5 minutes. And you can see she's using copious amounts of ivory as well as sterile water. And the scrub brush is a clean but not sterile scrub brush. She's using the scrub and the water to make nice suds. And then bringing that to the abdomen, starting at the cleaner area of the incision, so the purple circle, and moving outwards to the less clean area, but still part of the surgical prepped area, including the sheath after that. And this actual scrubbing part of this should last for the entire 5 minutes, and so the rinse would happen after 5 minutes. The goal here is to degrease and remove organic debris. This is very important. Many of our disinfectants are inactivated by organic debris, so removal of the grease and organic debris prior to the surgical preparation is very important. She's now drying any accumulated water off the inguinal regions and sheath with a clean towel. New exam gloves next, and a sterile chlorhexidine scrub brush. You can see she's opening that now, and she'll use sterile water with that to create suds. And then this is going to be the 2-minute chlorhexidine dirty prep. So a little bit cleaner, but still a degreasing step before the sterile prep. So this, again, this step should last at least 2 minutes of contact time for the chlorhexidine. Again, you can see she's starting at the inner cleaner area, not including the sheath closure, and then moving to the less clean area, which includes the sheath closure as a second step. She's using the sponge side of the sterile scrub brush for this step. She's also cleaning the inside of the flanks with this step, as well as the ivory. Both the ivory dirty prep and the chlorhexidine dirty prep should clean the insides of the flanks as well as the remainder of the abdomen. So once the chlorhexidine dirty prep is complete, then another rinse with sterile water. And again, towels used to dry the accumulated water in the inguinal regions and the sheath if necessary. The towels are, at this point, are not used to dry the cleaner area immediately around the incision. So next is the sterile surgical prep. So this part The alcohol gauze and the sterile chlorhexidine gauze should be soaking from before the horse is induced, so that the chlorhexidine gauze in particular is fully saturated with chlorhexidine prior to the scrub. So those would have been done using sterile gloves, and she will now have sterile gloves applied to use this to apply the surgical sterile prep. So you can see she's got sterile gloves on. She's just using a clean hand and a dirty hand. So she's using the clean hand to take the gauze from the container, using her dirty hand to perform the scrub. Same approach, concentric circles, starting at the incision and working outward, focusing on the cleaner inner area first, and then when you move to the outer area, that's when the sheath becomes part of the scrub. So this prep part should last for 5 minutes, and at the end of this prep, there should be 2 alcohol wipes that should be inspected that come away clean. So if there are, if the last alcohol wipe comes away dirty, then you would need to do 2 more alcohol wipes to get 2 clean alcohol wipes. So you just want to keep going with the prep until you get 2 clean alcohol wipes. You can see at this point she's really focusing on the abdomen itself. She does include the sheath closure, but she's not going up onto the inner surface of the thighs anymore. So again, just focusing on that inner cleaner circle and then moving to the outer less clean area and including the sheath closure in that outer less clean area. So once she has 2 clean alcohol wipes, and those clean alcohol wipes should be going around the entire prepared surface. So once she has 2 clean alcohol wipes, she's going to take additional alcohol gauzes and absorb any remaining residual alcohol or fluid in the inguinal region. Next is the DuraPrep. So she's puncturing the container within the applicator to allow the fluid to go into the contact with the sponge. And then she's using the abdomen to kind of get the fluid into the sponge. And then she's going to apply the DuraPrep to the entire surface of the prepared abdomen. Focusing first on the inner part of the surgical prep and then moving to the outer, less clean part of the surgical prep, but applying the DuraPrep to the entire prepared surface of the abdomen. Including the sheath and sheath closure. Thank you very much.